Welcome to another deep dive. You guys sent in a ton of research on primary hyperparathyroidism,
Yeah,
and honestly, it's a lot, even for us.
it is. Even for folks in the medical field working through all the research on PHPT, it can be pretty overwhelming.
Right, so that's why we're doing this deep dive. We're
Absolutely.
going to break down the most important stuff you need to know about primary hyperparathyroidism, PHPT for short.
Yep.
Basically, it's when those little parathyroid glands in your neck, they kind of go a little haywire,
Right.
and they mess up your calcium levels.
Exactly.
But the big question is, when does PHPT actually need to be treated?
That's the million-dollar question, isn't it?
Yeah, it's not always a straightforward answer.
Not at all. Not at all. There's a lot more to it than meets the eye, really.
Right, like when you hear PHPT, you think kidney stones?
Yeah, that's the classic. That's what everyone thinks of first.
Right, but it can be a lot more subtle than that.
Oh, absolutely.
So what else should people be looking out for if it's not always kidney stones?
Well, some of the research you sent mentions some interesting neuropsychiatric symptoms,
Okay.
things like fatigue, weakness, even like mild depression and memory problems.
Really? Depression and memory problems? I
Yeah.
had no idea those could be linked to PHPT.
It's one of those things that can easily slip under the radar, those everyday things, you kind of brush them off.
Right, right.
But what's really interesting is that studies suggest they can actually be reversed, potentially reversed with surgery.
Wow. So someone could be walking around thinking they're just stressed or getting older, and it could be this.
Yeah, it's possible, definitely possible.
That's kind of a big deal.
It is, and that's why early detection is so important,
Yeah.
making sure people know all the potential symptoms. It's not just about kidney stones.
So it really makes you think, like, could some of those everyday things, feeling tired all the time or just not thinking clearly, could that be tied to this?
It's worth considering, especially if you have other risk factors for PHPT.
So, okay, let's say someone is diagnosed with PHPT.
Okay.
Is surgery always the next step?
When it comes to symptomatic PHPT, where it's actually causing problems, surgery is generally considered the most effective treatment.
Okay.
But when it's asymptomatic, meaning no clear symptoms, then it gets a lot trickier.
Yeah. So how do doctors decide when it's necessary for those cases?
Right. Well, the guidelines take several factors into account.
Okay.
They'll look at your age, how high your calcium levels are, your kidney function, bone density, all of that.
So if not one size fits all,
Not at
a
all.
lot of individual factors.
It's a balancing act, really.
Right.
Because some people with asymptomatic PHPT stay stable for years,
Okay.
and others see it progress.
So you can't just say, you've got PHPT, you need surgery.
Nope, not that simple.
Okay.
But here's a really important point that often gets missed. Long-term observation, we're talking like 8 to 10 years, often shows a decline in bone density, even without other symptoms.
Wow. So even if you feel fine, there could be damage happening.
That's right.
That's concerning.
It is. That's why regular monitoring is so important, even for people without obvious symptoms.
So you can't just ignore it and hope for the best?
Definitely not. Monitoring lets doctors catch any progression early on.
Okay, so I know surgery is often the go-to, but what about alternatives?
Yeah, good question. So there are non-surgical options for managing PHPT.
Like what kind of things are we talking about?
Usually the first step is lifestyle changes.
Like drinking enough water or watching your calcium intake, that kind of thing.
Exactly, yeah.
Okay.
But sometimes that's not enough, so medications like bisphosphonates and calcimimetics might be considered.
I have to admit I'm not really familiar with those.
Yeah. Well, think of bisphosphonates like bone protectors.
Okay.
They slow down bone breakdown, help preserve that bone density.
Okay. So it's protecting your bones.
Right. And calcimimetics, they sort of mimic calcium in the body,
Okay.
which basically tricks the parathyroid glands into producing less of the hormone that's causing all the trouble.
Okay, interesting. So they're kind of tackling the problem from different angles.
Right.
But do these actually cure PHPT?
That's a good question. They don't. They can be helpful, manage the condition, reduce the negative effects, but they're not a cure.
Okay, so more like a temporary fix.
Yeah, you could say that. Surgery is still the gold standard for a lasting impact.
Okay, got it.
And, there's another interesting thing with PHPT. It often involves a vitamin D.
Ah, the sunshine vitamin, right?
Yep. Turns out vitamin D deficiency is pretty common in people with PHPT. And while addressing that deficiency is important, supplementing with vitamin D needs to be done carefully.
I'm guessing that's because vitamin D helps absorb calcium, so it could make things worse.
Exactly, yeah.
Yeah.
It's a delicate balance.
So it's not just take your vitamin D and you're good.
No, definitely not. It's about finding that right balance for each person
Right.
and being extra cautious with people who already have high calcium in their urine because it can increase their risk of kidney stones.
Makes sense. And speaking of situations that need extra care, the research you sent also mentioned PHPT in pregnancy.
Right.
What are the implications there?
Well, pregnancy has its own set of considerations, and even mild cases of PHPT can pose risks during pregnancy.
Oh, wow.
So early diagnosis and management are super important here.
So for women with PHPT who are thinking about getting pregnant, would you recommend they talk to their doctor first?
Absolutely. Always best to be proactive, address any concerns early on.
Right.
Sometimes surgery during the second trimester might even be recommended,
Wow.
but that's a decision that should be made with a healthcare professional who really understands both PHPT and pregnancy.
Right. So personalized care is really important here.
Absolutely, weighing the risks and benefits for each individual.
And that brings up a point I wanted to touch on. We've talked a lot about the physical effects, but what about the impact of PHPT on quality of life?
That's a really important aspect that often gets overlooked. And the research does hint at it, suggesting that even mild cases can affect mental well-being,
Okay.
leading to fatigue, low mood, trouble concentrating.
It's like this invisible burden.
That's a great way to put it, yeah.
So addressing PHPT, even in mild cases, it's not just about preventing physical complications. It's about improving overall well-being.
Exactly.
Okay, so we've laid some groundwork for understanding PHPT. We've talked about symptoms, from the classic ones to the more subtle ones, the guidelines for treatment, and the importance of personalized care. But now I want to zero in on the surgery itself. What does parathyroid surgery actually involve?
So the main goal of parathyroid surgery is to get rid of PHPT for good. Traditionally, that meant a bilateral neck exploration, basically examining both sides of the neck to find and remove the problematic parathyroid gland, or glands if there's more than one.
And this was all done under general anesthesia.
Yep, it was a pretty big operation.
Wow.
But like a lot of medical procedures, surgical techniques have gotten a lot better over time. So now, minimally invasive parathyroidectomy, or MIP, is becoming more common.
MIP, okay.
Yeah, it involves smaller incisions, sometimes using special imaging to target the affected gland.
So less invasive, faster recovery.
Exactly, and the success rates for both traditional and minimally invasive are very high, like 95 to 98%.
Wow, that's impressive.
It is, but of course there are still risks involved. No surgery is completely risk-free.
Of course. So for those who can't have surgery or choose to wait, what can they do to manage their PHPT and stay healthy?
That's where those preventative measures we talked about come in.
Right, staying hydrated, exercise, watching your calcium intake.
Exactly. It's about taking a holistic approach, managing your health, and even if you're not having surgery, regular monitoring is still essential.
To catch any signs of things getting worse.
Right, exactly.
So it's not a set it and forget it situation.
No, you got to stay proactive.
Okay, so let's go back to those medications, bisphosphonates and calcimimetics.
Yeah.
How effective are they long term?
They're not cures, as we said, but they can be helpful in managing PHPT, especially for people with low bone density. Okay. Bisphosphonates can help increase bone density, potentially lower the risk of fractures.
But the research mentioned that the bone density improvements with bisphosphonates aren't as big as with surgery, right?
That's true. Surgery is still the most effective way to deal with bone loss from PHPT.
Okay.
But for folks who aren't ready for surgery or can't have it, bisphosphonates can be a good option.
Got it. And what about calcimimetics?
So they're unique because they directly target that overproduction of PTH by the parathyroid glands.
Okay.
They can lower calcium levels effectively, but don't do much for bone density.
So more about symptom control than fixing the bone health issues.
Exactly.
Okay.
And they're usually reserved for folks with severe hypercalcemia or those who can't have surgery.
Got it.
They're not usually the first choice for mild cases.
Okay. Makes sense. And earlier we talked about vitamin D deficiency being common in PHPT, but supplementing can be tricky because of the calcium issue.
Right, it's that balancing act again.
So what's the best way to manage that?
Well, research supports checking vitamin D levels in everyone with PHPT.
Okay.
If there's a deficiency, repletion is recommended, but very cautiously.
So start low, go slow, watch those calcium levels.
Precisely.
Okay.
And extra caution for people with high calcium in their urine because of the kidney stone risk.
Right, right. It's not a simple fix.
No, definitely not.
We've covered so much about PHPT, symptoms, treatment options, the pros and cons of each approach. But before we wrap up, I want to talk more about the long-term cognitive impact. The research touches on it, but I'd like to dive a bit deeper.
Yeah, it's a fascinating area.
So even mild cases, if left untreated, could have lasting consequences for cognitive health.
It's a possibility. Remember how important calcium is for brain function?
Yeah.
So disruptions in that balance, even small ones, could affect thinking over time.
So those subtle cognitive symptoms like forgetfulness and trouble concentrating, they could become more pronounced.
It's possible.
This brings up a big question, and I'm not sure the research fully answers it. Could treating PHTT early, even in asymptomatic cases, protect cognitive health long term?
That's a really interesting question. Definitely an area where more research is needed.
Okay, well, I think we've done a really solid deep dive into the complexities of PHPT today. We've gone from those classic symptoms to the less obvious ones. We talked about the guidelines for treatment and how important personalized care is. And we even touched on that debate about when surgery is truly necessary. Plus, we hit those preventative measures, the role of medications, and that link between PHPT and cognitive health. We've covered a lot.
We have, and like always, there's always more to discover.
Right, medicine's always evolving, right? Our understanding of things like PHPT is constantly growing.
Absolutely.
So we've given you the highlights from the research you sent our way. But remember, this is just the beginning of your deep dive. Hopefully this has sparked some new questions and given you a good foundation to continue your own exploration.
That's the beauty of knowledge. It leads to more questions, keeps us curious.
And that's exactly what we hope this deep dive has done for you today. We want you to keep learning, keep asking those questions, and most importantly, stay curious.
Well said. Knowledge is power, especially for your health.
And on that note, we'll leave you with a final thought-provoking question from the research you provided. The studies tend to focus heavily on the physical effects of PHPT, but what about the long-term cognitive impact of even mild, untreated cases?
That's a question that deserves more investigation. Like we said, even small imbalances in calcium levels could impact brain health over time.
So could intervening earlier, even without obvious physical symptoms, be the key to protecting cognitive function as we age? It's a fascinating thought that needs more attention from researchers.
I agree. There's a real need for more research on the long-term cognitive effects of PHPT. It could change how we approach diagnosis and treatment in the future.
So there you have it. We've explored a complex medical topic, discovered some surprising things, and hopefully made you a little more curious along the way. Remember, we've just scratched the surface here. There's a whole world of knowledge out there waiting to be discovered. Keep diving deep, and we'll see you on our next deep dive.
Yeah, it really does impact so many areas of life.
Right.
Think about it. If you're dealing with fatigue or brain fog all the time because of PHPT,
Yeah,
it's going to affect your work, your relationships, even just how much you enjoy life.
that's so true. We get focused on the medical stuff, but it's easy to forget the human side of it all.
Right, exactly.
And that's what makes the research on the cognitive benefits of surgery so interesting.
Yeah, it's pretty fascinating stuff.
You mentioned earlier that some studies show surgery can actually improve cognitive function in people with PHPT.
That's right. Some studies show that after surgery, patients say their memory is better, they can concentrate easier, their overall thinking is just sharper.
So it's not just about feeling better physically, but mentally too.
Yeah, that seems to be the case for a lot of people.
Wow. It makes you wonder how many people are out there with undiagnosed PHPT struggling with these symptoms, and they don't even realize there might be a solution.
Yeah, it's a good point. It really highlights the importance of raising awareness about all the symptoms, not just the physical ones.
Okay, so let's say someone is considering surgery.
Yeah.
What goes into making that decision? It sounds like it's not always a simple answer.
No, it's not. The decision to have surgery is a big one, and it should always be made with a doctor who can look at your individual case.
Right.
But like we talked about before, the guidelines for surgery take into account things like your age, how high your calcium is, kidney function, and bone density.
And from the research, it seems like bone density is a really key factor,
Yeah.
especially when you're talking about the long-term effects of PHPT.
Bone health is super important. Even if you feel fine now, PHPT can silently weaken your bones over time.
And that increases the risk of fractures later on.
Exactly. So even if you're okay today, you got to think about the future.
Right. It's like a ticking time bomb almost.
That's a good way to put it, yeah.
Okay, so let's talk about the actual surgery itself. From what I've read, there's some debate about the best approach. Can you break that down for us?
Sure. There are two main approaches. Traditional bilateral neck exploration, which we touched on earlier, and the newer minimally invasive parathyroidectomy.
Okay, MIP.
Right, MIP. Can you remind me what those mean again? It's a lot to take in.
Sure. So traditional involves a bigger incision, and the surgeon explores more of the neck to find and remove the problem gland or glands.
Right.
And MIP is less invasive, smaller incisions. They use special imaging to pinpoint the exact gland.
Exact.
So MIP is more targeted, less downtime for recovery.
Yeah, that's the idea. And the research shows it's becoming more popular for good reason.
Yeah, it sounds like a win-win for patients.
It does, but it's important to remember every surgery has some risk,
Of course.
and the best approach really depends on the individual and their situation.
Right, so talking to your doctor is key.
Absolutely. Finding a surgeon with experience in both traditional and minimally invasive is important too.
Okay, so someone decides to have surgery. What kind of recovery are we talking about?
That's a big question for a lot of people. With MIP, recovery is usually much faster than the traditional way.
Okay.
A lot of patients go home the same day or the next day, and they can usually get back to normal activities within a few days.
That's not as bad as I thought.
Yeah, it's definitely less daunting than it used to be.
And the research supports that, right?
Hmm.
Less pain, fewer complications, quicker recovery with MIP.
Exactly.
But even with MIP, there's still things to keep in mind during recovery, right?
Oh, absolutely. There are always precautions after any surgery.
Okay.
Your doctor will give you specific instructions, but generally you'll want to avoid strenuous stuff for a few weeks.
Okay.
Keep an eye on the incision for any signs of infection and let your doctor know right away if anything seems off.
So communication with your doctor is key throughout the whole process.
Couldn't agree more.
Okay. What about potential complications? I know you said rates are low, but what are some things that could happen?
Well, like any surgery, there's always the risk of bleeding, infection, reaction to anesthesia.
Right.
And with parathyroid surgery specifically, there's a small risk of damaging the nerves near the vocal cords,
Okay.
which could lead to temporary or, in rare cases, permanent hoarseness.
That sounds a bit scary, but you said it's rare.
Yes, very rare. Experienced surgeons know the anatomy of the neck really well, and they take extra care to avoid those nerves.
It's good to know. And what about the long-term outlook after surgery? What can patients expect for their PHPT and their overall health?
The good news is most patients are completely cured after surgery.
That's great.
Calcium levels go back to normal, symptoms disappear, and bone health usually improves a lot.
So surgery can really make a big difference.
It can. It's not a miracle cure, but it's very effective and often improves quality of life significantly.
I want to go back to those cognitive benefits after surgery. The research mentioned it, but not in detail. What do those benefits look like?
Some studies show that after surgery, patients report improvements in memory, concentration, just feeling more mentally clear.
So not just feeling better physically, but sharper mentally too.
Yeah, exactly.
It's amazing that a surgery can have such a big effect on how your brain works.
It is. It shows how connected our physical and mental health really are.
So for people who aren't good candidates for surgery or choose not to have it, what are their options?
We talked about those lifestyle changes being the first line of defense.
Right. Staying hydrated, exercise, watching calcium intake.
Exactly. And along with those, medications like bisphosphonates and calcimimetics can help manage PHPT.
Can you remind us how those work and who they're for?
Sure, bisphosphonates protect your bones by slowing down their breakdown.
Right.
So they're often prescribed for people with low bone density to prevent fractures.
Okay.
And calcimimetics, they work by imitating calcium in the body,
Right.
which tricks the parathyroid glands into making less of the hormone that's raising calcium levels. So they're often used for people with really high calcium or those who can't have surgery.
Got it. So they're both useful, but in different situations.
Exactly.
It's all about finding the right approach for each person.
Right. Personalized treatment is key.
Now I want to talk about something we haven't touched on much. The emotional side of a PHPT diagnosis.
Yeah, that's an important part of it.
The research didn't really go into it, but I imagine it can be pretty overwhelming to be diagnosed with a condition like this, something that needs ongoing management and could involve some big decisions.
Absolutely. Any chronic condition can be tough emotionally, and PHPT is no different.
So people might feel anxious, scared, maybe even like they've lost control.
Those are all very normal reactions.
What advice would you give to someone struggling with a PHPT diagnosis?
First of all, remember you're not alone. Lots of people are dealing with PHPT, and there's support out there.
Okay.
Talking to your doctor is a good first step. They can give you information, guidance, maybe refer you to specialists if needed.
So communication is key.
Definitely. And connecting with others who understand what you're going through can be really helpful too.
Okay.
Support groups, online or in person, can provide a sense of community and a safe space to share your experiences.
That's a great point. Even though it's a physical condition, PHPT can really affect your mental and emotional health.
It absolutely can, and taking care of those aspects is just as important as managing the physical symptoms.
Okay, let's go back to vitamin D for a minute. It's a bit of a double-edged sword with PHPT.
Right?
Can you explain why that is?
Well, vitamin D is crucial for calcium absorption, so it's important for strong bones.
Right.
But for folks with PHPT who already have high calcium, supplementing with vitamin D can make things worse.
So you need enough for bone health, but not so much that it messes up your calcium levels even more.
Yeah, it's a delicate balance. Research suggests checking vitamin D levels in everyone with PHPT.
Okay.
If someone's deficient, they should usually take supplements, but very carefully.
So start low, go slow. Keep an eye on those calcium levels.
Exactly. And extra careful for those with high calcium in their urine because of the kidney stone risk.
Makes sense. It's not a one-size-fits-all solution.
Nope, definitely not.
Okay, we've talked about treatment options for PHPT, but I want to circle back to the long-term impact on cognitive function. We've touched on it, but I'd like to unpack it a bit more.
Sure, happy to dive into that. Like we've mentioned, a lot of the research focuses on the physical effects, but there's growing evidence that even mild PHPT, if it's not treated, can have subtle but lasting effects on how well your brain works.
So those seemingly minor cognitive symptoms we talked about, like forgetting things or trouble concentrating, those could be early signs of something more serious.
It's definitely a possibility. You got to remember how important calcium is for your brain.
Yeah,
So any disruptions in that balance, even small ones, could affect your thinking over time.
this brings up a really important question. Could treating PHPT early, even when there aren't any obvious symptoms, help protect your brain in the long run?
That's a great question, and it's one that researchers are starting to look into more.
Okay.
Some studies suggest there might be a window of opportunity where catching and treating PHPT early could prevent or even reverse some of those cognitive effects.
So it's not just about preventing physical problems like kidney stones or weak bones, it's about protecting your brain too.
Exactly. It adds another layer to the whole discussion about when to treat and how to treat.
This idea of a window of opportunity is really interesting. Is there any research that backs that up?
There are a few studies that hint at it.
Okay.
For example, one study found that people who had surgery for PHPT, their cognitive function actually improved after the procedure, even if they hadn't had any serious cognitive problems before.
So even if your thinking seems fine, surgery could still help your brain.
That's what some of the research suggests, but we need more studies to be sure.
Okay, so more research is definitely needed, but these early findings are pretty fascinating. They change how we think about PHPT and how it can impact our lives. And they highlight how important it is to stay informed about this condition and push for more research.
I couldn't agree more.
Okay, well, I think it's safe to say we've done a pretty deep dive into PHPT today. We've covered everything from how it's diagnosed, to the pros and cons of different treatments, to the importance of personalized care.
We've covered a lot of ground,
And we even touched on those potential long-term effects on thinking and memory.
and we've emphasized how important it is to see PHPT as more than just a physical problem.
Right.
It can affect your mental and emotional well-being, how well your brain works, and your overall quality of life.
It's about treating the whole person, not just the disease.
Exactly. And it's about giving patients the knowledge they need to make informed decisions about their health.
And I think we've done that today. We've given you a clear picture of PHPT, explained the medical jargon, and presented the information in a way that's easy to understand.
Hopefully, this has given our listener the tools and the motivation to keep learning about this interesting and often overlooked condition.
And on that note, we'll leave you with one final thought.
Okay.
A lot of the research focuses on the physical and cognitive effects of PHPT. But what about the social and emotional side of things? How does living with PHPT affect your relationships, your work, your sense of self?
That's a great point. It's something that deserves more attention, and it shows how important it is to take a holistic approach to understanding and managing PHPT.
Couldn't agree more. We've given you a good starting point, but there's always more to learn.
Absolutely.
Keep diving deep, and we'll catch you on our next deep dive.
Ah,
Yeah, it makes you think about the bigger picture.
definitely. It's not just about the numbers on a test. It's about how this condition impacts every part of someone's life.
Okay, as we wrap up this deep dive, I wanted to circle back to something you said earlier about the need for more research on PHPT.
Right, right.
Where do you see the biggest gaps in our knowledge right now?
Well, we've learned a lot about PHPT recently, but there's still so much we don't know. Like one area that needs more research is the long-term impact of even mild PHPT if it's not treated.
Okay.
We talked about those possible cognitive effects, but we need to understand more about how this condition might affect your health over time, even in subtle ways.
So even if someone's not feeling any symptoms right now, there could be problems down the line.
That's definitely a possibility, and it shows why it's so important to keep monitoring PHPT, even if there aren't any obvious symptoms.
What about genetics? Does PHPT run in families?
That's another area where we need more research.
Okay.
We know that some types of PHPT can be hereditary, but we don't fully understand the genetics yet.
So if someone has a family history of PHPT, they might be more likely to get it.
Generally, yes, but it's not a guarantee.
Yeah.
There are a lot of factors at play.
What about environmental stuff? Could things like diet or exposure to certain chemicals contribute to PHPT?
That's a really interesting question, and honestly, one that hasn't been studied enough. There are some hints that certain environmental factors might play a role, but we need more research to be sure.
So we still have a lot to learn about what causes PHPT and how we might prevent it.
Exactly. That's why research is so crucial.
Yeah.
It helps us understand the condition better, develop better treatments, and ultimately help people with PHPT live healthier lives.
I think this deep dive has done a great job of showing both what we know and what we still need to figure out about PHPT. We've covered a lot of information, but it's clear that there's always more to learn.
Absolutely, and hopefully this discussion has encouraged our listener to keep learning about this really interesting and often overlooked condition.
I hope so too.
Hmm.
We've given you the tools and the knowledge you need to navigate the world of PHPT.
Right.
Now it's up to you to keep digging, keep asking those questions, and keep advocating for more research.
Well said. Knowledge is power, especially when it comes to your health.
And on that note, it's time to wrap up this deep dive. Thanks for joining us on this journey of discovery, and we'll catch you on the next one.